So I will be doing the IV insertion video and discontinuing of the IV. I have gathered all my supplies. Unfortunately, in my kit, I did not receive the correct needles, so I will be improvising with what I have on hand. I hope to get those soon. After I have identified my patient, I'm going to do hand hygiene, then put my gloves on. I will then be taking my normal saline and my connector tubing, and I will disconnect the ends on it, ensuring that I don't contaminate it, and I will place the normal saline on the tubing. Then I want to get the tubing ready for when I insert it. So I'm going to make sure that there are no bubbles in my tubing. So I will be letting a few drops out. Then once that's done, then I will put the lock little push lever on there, set this down so it doesn't get contaminated. I will then place the tourniquet on my patient, ensuring that I don't do it too tight. It's going to be placed about 4 to 6 inches above where I will be inserting the IV. I want to make sure that I have a distal pulse, and I do. So I will then take an alcohol wipe, and I will take the wipe and start in the middle and do circular motion out and let that dry for about 30 seconds. I will then take my needle, which I have chosen a 22 gauge needle for my patient that's going to be getting IV fluids. I will uncap the needle and make sure that the bevel is up before inserting it into the skin. I'm going to take my thumb and hold the skin taut and stabilizing the vein before I insert the needle. When I insert the needle, I'm going to go in at a 30 to 45 degree angle. And once I've gone about 1/4 of an inch, I want to see a flash, and I do see a flash. So then I'm going to then advance the catheter about 1/4 of an inch to ensure that the needle is inside of the vein, or the catheter is inside the vein. Then I am going to disconnect the needle and advance the catheter all the way up until the hub is directly all the way up to the skin. Going to stabilize the needle the catheter with my first finger. Going to put the safety on the needle, put it in the sharps container. While I'm holding the catheter, I'm going to then connect very quickly my line to the patient and the catheter. Then I'm going to I'm going to loosen the tourniquet, and I'm going to check and make sure that aspirate and make sure that there's blood to ensure that I am still in the vein. Once I know for sure that I'm in the vein, I'm going to then insert the normal saline into the vein. And then I have done that. I will then clamp it to ensure that it's closed. Then I will be finished with the normal saline, so I will then dispose of the normal saline. Once that is done, then I'm going to take my sterile dressing, and I'm going to then place the sterile dressing on my patient, covering the IV site and just a small amount of the catheter, ensuring that it's in place and it's stable. Then I will remove the rest of this dressing. I will then take a piece of tape that I have prepped prior to starting and loop around the IV and place the tape down so the IV does not go anywhere. I am then going to take a piece of this little tape thing, and I'm going to write the date, the time, the gauge of the needle, and the length, and my initials, and then I will place it on my patient. Then I'm going to clean up all of my mess, dispose of all of my garbage. I'm going to place any sharps into the sharps container and say goodbye to my patient. Oh, not before I remove my gloves and perform hand hygiene, though. Then after I have left and I've come back and I am going to explain to my patient that I will be discontinuing the IV. So what I'm going to do is I'm going to do hand hygiene, going to put new gloves on. Then I will be carefully removing the tape from the IV site, as well as the sterile dressing. Again, carefully so that it does not hurt the patient. Sometimes patient's skin can be very thin and we don't want to cause any injuries. I don't think I can say that. And then we're going to take a piece of sterile gauze and place it right above the insertion site to ensure that there's just a small amount of pressure, and I'm going to remove the catheter from the patient, bringing the catheter out parallel to the patient's skin and making sure to keep the pressure there and to hold it there for 30 seconds till the bleeding stops. Going to place the catheter into the sharps container. Once I've been holding pressure for about 30 seconds, I'm going to get a new piece of sterile gauze, going to remove the dirty gauze and place clean gauze on the patient, as well as a piece of tape. Remove my gloves. After I've already thrown away all of my garbage, and perform hand hygiene.